Welcome back to Advancing Healthcare Through Simulation, where we explore the people and ideas driving meaningful change in healthcare. Today I'm joined by someone whose career truly defies the boundaries of any one title or sector, Tyler Tamayose, a cross-sector executive leader known for turning bold ideas into real-world impact. His career spans healthcare, government, startups, academia, hospitality, and even sports and entertainment, leading transformation from the front lines to the boardroom and across entire systems. Tyler is the president and principal consultant at Banyan Strategies, where he helps organizations, governments, and nonprofits navigate complex challenges and unlock transformational growth. He also serves as a strategic advisor with Health Cities, focusing on health AI and data systems, and sits on several boards and committees, including the Canadian College of Health Leaders, the Canadian Rural Community Wellness Institute, and the Glenrose Hospital Foundation, advancing innovation and care for patients and families. Named to Edify's 2025 Top 40 Under 40 class, Tyler has worked with governments and partners across Alberta on some of the most transformative initiatives shaping the future of health. He brings clarity, precision, and collaboration to complex systems grounded in a belief that Alberta can build a better future. One bold idea, one smart collaboration, and one implemented solution at a time. Please welcome a visionary leader committed to shaping the future of health, innovation, and community impact. Tyler, it's such a pleasure to have you here. Welcome to the show.
Thanks for having me, Lisa. I'm looking forward to delving in.
All right, well, let's get started.
Absolutely.
I mean, you've had such a varied journey through healthcare, from frontline operations to innovation, leadership, and now running your own consulting company. How would you describe the path that brought you here?
Yeah, it's been a varied journey, that's for sure. And I think you encapsulated it just a little bit in, the introduction. But there's this quote that really stood out to me over the last year as I've been reflecting, I guess, on my journey. And the quote is, "The degree to which a person can grow is directly proportionate to the amount of truth they can accept about themselves without running away." And so when I look at the truths that I've been able to explore across my journey, at least in healthcare, I've been able to navigate across acute care, primary care, operations. I've been able to do digital health, strategy, academia, partnerships, government relations. And, one thing that I've learned across that system is that there's so many lessons to be learned in each one of those roles. And the things that I really pick out on are the blind spots, the tensions, and one key word that I really want to hit on is like humanity. The humanity that you can pick out of each one of those experiences. And so in healthcare alone, that's an impressive journey. I mean, of course, what we do want to hit on as well is that in healthcare, you do need specialists, right? Like you're not going to want to get a heart surgery done by somebody who's not a specialist. And I think that's really important to kind of key in on the audience that's going to be talking about that. But for me, growth has always been about, leaning into the uncomfortable, seeking out the truths through each one of those domains that I had mentioned before, and using expertise as a platform and not necessarily the finish line. Mm-hmm. And so a lot of people may ask what that means. And for me, I always find that when you're looking and searching expertise and through each one of those domains that I just mentioned, you end up becoming a certain level of an expert within it, whether it's in quality or innovation or digital health or acute operations. People lean on you for that expertise. And for me, that was never the finish line at all. And so I wanted to seek out so much more. And so really for me as well, I also find that I've tried to live up to this measure that it's not what I have done to date. It's always about what I do every day, how I show up, how I work hard, and how I look to make impact on the work that I do on a daily basis. And really through all those layers, and you hit on a little bit, bedside, boardroom, everything in between. I think that that's one of the biggest things that I've learned through deep understanding of how my journey has been is really how do you connect the people? How do you connect those values and the knowledges? And so that journey kind of encapsulated why I started my consulting company, Banyan Strategies. It was about how can I take the knowledge and the experiences and at least that deep-rooted passion that I have for healthcare, and how can I give it out to others? Small, large, governments, boards, like these are the things that I want to work with, and I'm super passionate about that.
Well, that definitely comes through, and it seems like it's really served you well in your journey to the state. I'm excited to hear more about that. Thinking about leading at every level, I imagine those early experiences still really helped shape how you approach leadership today. And when you think back to your early days in the system, what moments stand out as defining and how you lead now?
Yeah, thanks, Lisa. There's no shortage of examples that I can talk about in my journey, obviously, but there was one story that I really never shared with anyone, and it's when I was in university. I did my senior thesis with the medical officer of health down in the South Zone, and when I came back, I was fortunate to be able to do my practicum and do some hours down there with her. And so I spent 2 months with her. When I first started there, it just so happened that it lined up with the H1N1 crisis. And so I'm this new, pre-med student coming out of university, and I was able to help not only just take part in the incident command, sitting in the room, but I was able to set it up and really understand the principles that exist within that space. And so when I was sitting in this space, I'm sitting around groups from operations, CPSM, public health, and at that time, I really didn't even know what those titles meant, right? Like how diverse is healthcare? And so what I really admired about that group was the communication that they had together. Really, like you watch each one of these leaders, and each one of them instinctually will know exactly what they should and they should not do in this exact moment of crisis. And so when you sat there and you took in these diverse perspectives and how they kind of collaborated together around something so big, it's something that stayed with me for my entire career from that point on. And really, when you look at the complexities that we have today, we need deep collaboration. We need diverse thought leadership. And I think that coming together like it was in that H1N1 scenario, it's exactly what I've kind of stayed true to. And, having worked across so many different sectors and so many different areas of the healthcare system, I've built a wide net around who's who, what do they bring? And I kind of pride myself on being that convener of diverse thought. And I think it kind of stemmed from those early days where I was able to see the diversity, even though I didn't really know what that meant at the time. Now I totally see where you need multiple players at the table at the exact same time to solve these really complex problems.
Yeah, that sounds like it would have been quite the crash course.
It was,
that experience. So I can see how you've taken that with you. Definitely.
Yeah, I think you can take a lot out of your early journey, but for me, sitting in rooms where you're kind of this newcomer coming in and looking around and seeing people who are, like we mentioned before, experts, and just seeing how they approach situations, understanding their mission and their values and their skill sets, like this is really critical. And how they kind of came together is really special, and healthcare is really diverse that way.
Definitely.
Yeah.
So I want to first congratulate you. You were recently recognized in Edifi's Top 40 Under 40. That's fantastic and very fitting for everything that you've done. After years of driving impact behind the scenes, how did it feel to be recognized so publicly?
Yeah, first off, thank you, Lisa. It was a complete surprise, and I'll get a little bit more into all the journey that it kind of went on, but really it was a special moment for me and my family and my two kids, Blakely and Tobias. And so they're little, and so they get to talk to them about this and showing them the magazine now. I mean, these are really cool moments that you can share with them around kind of purpose, right? As you're going through your journey, that good things happen, but it takes effort and takes failure. And so really, when I was asked, when I was told that I was nominated, right? You get a message that you're nominated, and I mean, that's a surprise in itself. You're like, okay, great. And at that point, they kind of ask you to write this essay and a little story. And so I put a little thought into this, and you really reflect on your journey, and you write down all these things, and you compile all these stories. And so for me, I've worked in 5 organizations, 13 domains. Like I've been on 6 different boards to date. I've mentored over 200 different startup companies. And so when I'm sitting there and I'm thinking about, the trials and tribulations of your career, the failures, job loss, the things that got you to this point, and even the reasons why I came up to Edmonton to begin with all those years ago. I remember those days. It was hard. It was challenging. You're not sure that this is the right way. And for me, like when you write this all down and you encapsulate and put it out into the universe and send it off, and it goes into this pile with what do they say, like 400, 500 different applicants that got nominated, it's special. And then I remember this day when they had finally said that I had won. So I was sitting at the dentist office with my daughter for her first dental appointment, which is obviously exciting too. And they called and they said that I was chosen as one of the top 40 this year for the 2025 class. And I remember having this, deep rooted in a positive way, like emotion about it. It was kind of like shock. It made me stop and think about that path that I wrote down. And, I do believe that it was the resilience that took me to that point, that I was able to kind of all hit me at once when I had that conversation with the person on the phone. And, when you've worked behind the scenes for so many years, and a lot of amazing healthcare leaders out there right now are as deserving as I am on this one, and I share this award with them, the ones who basically stood side by side with me during some of the hardest moments of healthcare, pandemic, launching Connect Care, when we're talking about how we're going to move forward from a refocusing perspective. And so I really do look at how can I share this with them, because at the end of the day, I've been afforded the ability and the platform to be able to do some big things. And I've built a lot of relationships and networks along the way. And I'm humbled by this recognition. And I truly believe that it is an honor, that it isn't just about me. And I reflect on everyone along that journey. I'm just really appreciative.
Well, good job, reflecting and taking that moment in and really taking the time to absorb that and celebrate it, because often I think a lot of people don't. They're just jumping to the next stage, right? So
it was one of those things that was surprising to me of how much reflection it took. It hit me a lot differently, and maybe it was because you are rushing through your career and you're making moves and you're being tactical, but at the same time there's some moments in your career where you have to get stopped on that journey, and you have to really just smell the flowers and really appreciate how far you've came. And for me, it's not that easy for me to do that, but I think this is one of those moments where I got to really live in it, and it's been really special.
So healthcare is often seen as structured, procedural, but you've been a strong advocate for creativity and innovation. Why is it so important for healthcare leaders and teams to have space to think creatively?
Ooh, that's a big one. Through my journey, I've worked with thousands. That's no exaggeration. Frontline members, the best of the frontline leadership and executive team. And really what I've found through all the various levels, that creativity can thrive in survival mode. And what I mean by that really is you need oxygen before you can innovate or think about how you might be able to transform. And so when people are constantly in reaction mode, and this is in healthcare, you see it, it's triage environments, sometimes there's life or death. And so a lot of people, they absorb that a little differently in how they approach their day to day. And so sometimes when you are reacting constantly and you're doing the right thing based on your instincts, you really do lose the ability to imagine a better way of doing things. And the best leaders are the ones that make space for themselves and for their team to reflect. It's not really like a buzzword or one of those things that is very, very innovative, but really reflection is a big part. And even short pauses to think can reset a team. It can reset their perspective, can give them the ability to come up with a solution. And I want to give an example. And so when I was a part of a leadership team at a large acute care facility, I was able to create this thing called Medicine Minds. And Medicine Minds came from the belief that when you allow leaders the space, afford them ability to learn different and have diverse thoughts, that they can truly come up with some really amazing things. And so I had about 30 different managers, CNEs, directors that attended this, and it was really just a space to decompress. I brought in guest speakers, I brought in unique thinkers, and so it was just space. And I remember in those times, a lot of the team members were like, I got to get back to the units, I got to get back to the fire. And in that moment, we just wanted to sit there and absorb the moment of freedom. right? Of freedom of thought, freedom to sit there, because I also believe, and you'll be aware of this as well, that when you are coming up and you're in a think tank with somebody, and sometimes it's really hard to come up with that idea, but then all of a sudden you're driving home or you're cleaning the dishes and that idea pops into your head. And so as leaders, we need to start to instill those moments and where you can actually pause and come up with those amazing things. And so this kind of stemmed from at least my view on when we were in the pandemic and when we were launching Connect Care over the ecosystem for the last few years. Leaders were consumed by policies, processes, crisis management, and really the environment left little room for creative thought. Like when asked, they're giving things, they have to react to them and give it out to their staff, but they were never asked to edit it. They were never asked to evolve how this might be able to work in their areas. And so that's one thing that I first saw firsthand was when you give experienced clinical leaders a permission to think creatively, then you really start to reimagine how the system works. And I firsthand saw when you do this, some of these stories that come out of the leadership, frontline management, they are able to do some really amazing things. Like the outcomes are immense. Their facilities are stronger, their organizations are stronger, and you feel it within their culture. And so when I think about creativity and allowing space, it is CAMS that comes to mind. And I think at NAIT, especially specifically in the CAMS area, simulation, that's what it really stands for. And I know I'm preaching your language right now, but I'm an advocate to it, right? Like I believe that when you allow frontline team members, executives, students, the space to be creative, to de-risk, to allow for them to create and experience things in a new light. And it could be a code blue. It could be scenarios that obviously you can't have real world examples. It's really special. And I think that space and freedom allows for them to have creativity and be able to now go back onto their devices when it happens in the real world. And so again, encapsulating all this, it really just gives teams the pause to reflect and to reimagine what's possible out there. And I think that is one thing that we need to invest in significantly within our health system and abroad.
And I think the impact on that experience as a team is probably huge for that culture, as you said, right?
Absolutely. And there's a book. It's by Bill Campbell, and he is it's the billionaire coach, I believe. And he spoke about the importance of executive and CEO level leaders to book this out practically every week, to be able to have space to say, what did I do wrong? What am I missing, right? Like this isn't just about innovating. This is about keeping your baseline. And in a day-to-day, specifically in healthcare and in the agile world that we live in, what are you not doing? Like are you operating at 100%? And so I think that's a good practice to be able to take into consideration as you move forward within healthcare.
Mm-hmm. Yeah. That's wonderful. So with your cross-sector perspective, I'm sure you've noticed some reoccurring challenges. What's one system issue that you think we keep approaching the wrong way?
Yeah, just one. Yeah, let's start with one. But one of the biggest challenges we keep getting wrong and is thinking healthcare can innovate and transform entirely on its own. And I think you being in academia and being at arm's length from a lot of the healthcare groups, like you'll understand kind of what I'm referring to. But, inside the system, we have some of the most dedicated personnel, professionals, leaders you'll ever meet. You'll have clinicians, you'll have administrators, you have researchers, like people who know the problem. They live this problem. They feel it every day. And so, but when it comes to true innovation, the kind that takes us from idea to impact, it rarely happens in isolation. And so the health system is incredibly able to improve what already exists. It really is. Like they're some of the most advanced quality improvement people I've ever worked with in my career. The frontline teams know exactly what they should do and when they should do it. But when it comes to creating something new, like that 0 to 1 thing, it needs to reach beyond itself to be able to achieve that. And so that's where external innovation ecosystem, and I'll keep saying innovation ecosystem as we go throughout our talk, that's when they come into play. There's deep expertise, there's investment, there's knowledge, and really these are all just sitting outside of the walls of the healthcare system. And when you bring in entrepreneurship, you bring in venture capital, you bring in accelerators, you bring in these worlds and these academic groups, I think that that's the collision that is necessary between the two entities that can happen. And I don't think we've done it, very well over the last little bit. But at the end of the day, when we bring them together, transformation starts to take shape a little bit, and you see little areas and little tidbits of it happening across the ecosystem. And that often happens from conveners and groups that are coming together and being a little bit brave of dropping their bottom line and allowing themselves to be vulnerable. And so when we start to talk about areas like CAMS, some of the campaigns that you guys have done lately has been remarkable with, the innovation highway and allowing for collaboration to happen across even academia. I mean, your partnerships with polytechnics across the province is something that I admire. It allows for you guys to say, hey, we understand that we are together, but we know that we can be stronger collectively. And so that's something that I really have appreciated. And the system already has a lot of knowledge. Like, we know that together. What it needs is connection. And I think that when we start to bring together the innovation ecosystem with the healthcare system, who speak two different languages, I might add, we allow for the co-creation of really something special. And we've seen other jurisdictions do something similar. And I think in Alberta, we're onto something special here.
Yeah, you can definitely feel the momentum building, and we have people like you helping push it forward. Yeah. It's really taking shape. So speaking how you work so closely with both innovators and frontline teams, two worlds that, as you said, don't always speak the same language. What are some of the biggest gaps you've noticed between those groups, and how do you help bridge them?
Yeah, so the gap between innovators and frontline teams couldn't be bigger. And it's one of those things that I know we alluded to before, but I've had the privilege of mentoring a couple hundred startup companies across the world, all looking to innovate within the healthcare space. And both sides want the same thing. They really do. And you see it in the accelerator programs, you see it in the pitch competitions that you had seen recently that NAIT had put on. But rarely they speak the same language. And I know I've hit on that a few times, but innovators bring brilliant ideas, they bring funding, they bring energy. It's kind of contagious when you get to meet with startup companies, right? But many of the solutions don't directly fit what clinicians and patients are actually needing right now. And so the frontline teams, they understand the problem, they understand the challenges, and they experience that daily. Like, we know that, right? Like, they're the ones closest to the fires and the coals, like we might say. And so, but we often lack the access to the innovation ecosystem. So it's like, even though their heads down, they know exactly what the problem is, they don't know that there's a group out here that's trying to solve it for them, right? And so I often find myself acting as kind of that intermediary, where I'm trying to do introductions, where I'm trying to find what the solution might be, where the problem might be, and just doing it. And through my journeys, I've been able to kind of match it a little bit differently across the province. And so really, we can't rely anymore on coincidence of these things happening. I think we need to be more practical with structures and governance. And that's not the sexy thing in the room to talk about governance and collaboration and all this stuff. But I think as we move forward as a province, and when we talk about health, innovation, transformation, like, one of the things that I really take on is that there's other jurisdictions doing this very well, right? Like, the NHS has a program called the Accelerated Access Collaborative, and really it's inspiring, right? It brings together government, clinicians, industry, investment, and patient groups all under one coordinated ecosystem. And they know that this acts as the front door, really, for the innovation ecosystem. So it helps match clinician needs. It helps match funding. It really knows exactly how to kind of navigate into each one of the systems. And here in Alberta, when you look at, we know very clearly that we have ministerial mandates, right? We know clearly that we have agency priorities. We know each one of the facilities has a specific problem based on the social determinants of health. We know exactly the skill level that happens in collaborations with a lot of the institutions, academia, that's included. And so I think that we here in Alberta are on the cusp of doing some pretty cool things, but we need to start to put some more practical steps in place. And so really, when we look at imagining that front door to innovation where needs, ideas, and funding align. We pair that again now with NAIT CAMS, who has now de-risked a ton of startup companies, which is amazing for you guys to do. You really start to see some homegrown innovations that are tested here, that are loved here, and that are sustained here. And a lot of those companies start to add to the economic value of our province. And so this isn't just about innovation anymore. It's coordination, it's courage, it's building structures that let good ideas take root. And that's something that I believe could be done here in Alberta.
Mm-hmm. And helping them understand the value for both sides, right? I'm sure that's, like
Absolutely.
you said, the language piece,
Absolutely.
Right? Yeah. So as you've alluded to, there's a lot happening in Alberta's innovation space right now, from AI to data systems, from community-led care. And when you think about the province's innovation ecosystem, what excites you most about where it's headed?
Yeah, that there's no shortage of noise specifically in that area right now, not just in the province, but globally, which I think adds some motivation and pressure for Albertans to show up differently. And really what excites me is the people here in Alberta. And, Alberta is full of passionate builders who want to do good. They want to make impact. And so I really believe we already have a lot of the right tools. And I know me and you have talked about this before, but it really just hasn't come fully together yet, for various reasons. But, the momentum is real. I believe that you can feel this in the conversations in the hallways. You can feel this basically when we go to all of the various events. You can feel it in the classrooms. The way people are thinking differently about what's possible. In most industries, I want to go into an analogy as well. You have a lot of people who think linearly. It's just how we've been raised, right? If box A is blocked, then the puzzle can't be completed. You have to stop, right? We're not going to keep the project going or I'll delay it, right? Mm-hmm. But Alberta has a different kind of builder, and I know you probably experience these people a lot in your day-to-day, but the ones who, when box A is blocked, they change the puzzle. They question the rules that define it in the first place. And that's the essence of innovation here. And I think that we're getting to a point where we're seeing groups of people that are coming together to refuse the acceptance of constraints as final. Mm-hmm. You can actually see this in the next generation. I know you're probably seeing this at NAIT right now. Young people coming out of universities, high school, polytechnics, they really aren't content with that's the way things have always been.
Yes.
I'm very similar. I going through the system and working in as many areas as I have, you hear this a lot, that, this is kind of the way we've done it. We can't do that. But at the end of the day, the new generation coming up, they're curious, right? They're impatient. They're bold enough to question boundaries. But they're also willing to keep pushing when the path isn't clear. Mm-hmm. Every generation kind of builds the scaffolding for the next, but this one is not afraid to kind of tear down the walls first, right? And that's exactly what Alberta needs right now, specifically about the topics you mentioned before. And I was able to judge an event that NAIT put on a few years ago, a VR event of high school, and it shocked me. I was not this way in high school, so thinking about what this might mean for the next generation, and when you start talking about clinicians on the front lines, nurses want different things now coming out of universities and institutions. They're thinking differently. They're entrepreneurial. I think that this is one thing that we're creating a movement here and that I'm getting really excited about. And so if we can align the structures, kind of like we mentioned in the previous conversation, if we can align the incentives and take that momentum, it's going to be something special because Albertans, they're gritty, they're bold, they're inventive. And if I can place a bet on any place in any group of people, I would actually place a bet on Albertans, and I would do it over and over again. So I'm really excited to see what the future brings in those areas.
I would second that. Yeah, I think there's a lot coming our way. So you've mentored and advised many emerging leaders, stepping into a rapidly changing system, as we've discussed quite a bit today. How do we prepare the next generation of healthcare professionals to lead differently?
Yeah, that's a good question. I thought a lot about this over the last few years as I've reflected on my own journey as a leader and taking in just the questions, I guess, that the frontline people that I mentor a lot. I think it starts with changing how we define leadership. And so for too long, we've tied it to titles. I'm a nurse, so I'm going to manage nurses. I'm a physician, I need to manage physicians. Someone with an MBA. Those backgrounds do matter in a lot of contexts, but leadership isn't about where you come from. It's about how you show up every day, right? And I mean, really, that's not complex for me. But great leadership comes down to two things. It comes down to smarts and hearts. And this is something that I really love because you need both. Smarts gives you the ability to analyze, learn, navigate complexity. And hearts, it gives you compassion, humility, and the courage to care, and especially when things get hard. In healthcare, there's no shortage of that. You're going to face that every day if you're a healthcare leader. So if you want the next generation of people to lead just a little bit differently to how we are, we want to teach them that in leadership, it is both a skill set and a mindset, and it's not necessarily a position. And so we also need to encourage people to try new things throughout their entire career. Very similar to myself. The best leaders didn't stay in one lane. They moved across settings, they took risks, they learned from failure. And so that's how adaptability and creativity are built, by seeing different systems, different structures, and seeing it from a different angle. And the leaders who really, really inspire me are the ones who most balance smarts and hearts. They are curious enough to keep learning, and they're human enough to keep listening. And so I think that if I can really encapsulate what we need to do for the next generation, that would be those things, is really focusing on that area. But for the ones that are already in senior leadership positions and executives, I look at it from three things. Keep coming up with big ideas, being able to execute on those big ideas, and then also being able to mentor and nurture the next generation of leaders. And so I think, two-pronged, what's coming up and how do you function right now as an executive leader?
Well, that sounds like a wonderful summary for me to share with my IPE students around leadership. So thank you for that. Yeah. And now moving on to, as president and principal consultant of Banyan Strategies, you're driving change from outside that traditional system. Running your own consulting practice gives you that freedom to move quickly on big ideas. How does that help you make impact differently than when you were working within those large organizations?
Yeah, that's you brought up the word freedom, and for me, I want to break that down a little bit more. For me, it is freedom, and it's not just in time, not freedom in time, but in purpose. Mm-hmm. I have the freedom to do purposeful work and navigate around and do that. So I've always loved to do the big and the meaningful stuff, sometimes the messy things, like obviously like taking on Connect Care or taking on various other multi-million-dollar projects across the ecosystem that had timelines. There was acuity involved. And so when I look at how I run my own company now, that means I get to choose the projects that matter, the ones that are actually have the chance to make change, something special. And like you probably experience this daily, where you get to meet people and you're like, these people are really eager to do something big, and you feel it, like you can feel it on them. And so for me now, from a consultancy perspective, I get to partner with those people. I get to partner with agencies and governments and organizations, innovators, academia, even multinationals, and endless amounts of boards. People ready to do the work, not just talk about it, which is really special for me too. Inside the system, you have layers and processes and politics that are, they can really slow really good ideas. And so as a consultant now, I get to move a little bit faster. I get to navigate to this group, and I get to listen to their problems and their aspirations and be able to help them around that journey. And so really, when it comes down to bringing together people across the boundaries, connecting the dots that others might not see, and help teams really find that momentum, that's what I really love. And when it comes to my passions, it's very clear. People who know me, they know that my passion is implementation, right? So everyone will be like, if you're a consultant, you don't get to implement anything. And at the end of the day, when you choose your path and you choose to run your own company, you get to change that dialogue. You do. So for me, I get to jump into projects. I get to run them the way that I want to. I get to take those ideas and allow them to kind of take shape and to genuinely help people. And so I really take pride in taking clients' needs and expectations and really elevating it to another level. And that's something that I really take pride in at my company. And so when we look at the name Banyan Strategies, that came from the belief that the banyan tree grows wide, is deep, its roots stretch towards and outwards. It connects, it builds strength over time. That's how I like to work. at the end of the day. And it's helping people in system find each other, sustain ideas over a long term. Alberta has an incredible talent pool and people that drive creativity every day. And so I love giving them the chance to kind of execute on their vision. And so at the end of the day, Banyan was built on just the simple idea that I want to help people connect and grow together. And I also want to do the work that keeps giving me passion, that keeps allowing me to be a continuous learner, that also allows me to do the big things that I really like to do.
Sounds like a very rewarding and energizing experience. So
Absolutely.
Thank you so much for coming here. A very inspiring conversation. You've given us a lot to think about, and from the power of collaboration and reimagining how we lead innovation in healthcare. So thank you so much, Tyler.
Thank you very much.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.